Happy Friday, everyone, and thanks for joining me for episode 7 of the Security Nurse Podcast. What's it look like when there's a CEO that leads with compassion and empathy? Well, that's what you're going to find out today as I interview Jamie Marcellus, an RN with an MBA, who's currently the CEO of Novus Health, a technology-enabled health services provider and leader in health navigation. Jamie started his career as a bedside registered nurse and seamlessly transitioned into leadership roles, blending his clinical expertise with sharp business acumen. He's a healthcare entrepreneur at heart. He's driven transformative growth at several organizations, including 2 recent exits, most notably HumanaCare, which was acquired by CloudMD in 2021. I became acquainted with Jamie on LinkedIn and was instantly drawn to his post talking about compassion and empathy in that C-suite CEO role and how his skills as a nurse really helped propel that position forward and helped him succeed that much further. So it's amazing to see a healthcare CEO leading with empathy and compassion, and I hope you enjoy the conversation today. Good afternoon, everyone. Well, I am here on the Security Nurse Podcast with Jamie Marcellus. He is a Nurse Now CEO from Toronto, Canada, and I am so excited to have him here. How are you today, Jamie?
I'm great. Thanks for having me on.
Oh, it's fantastic to have you. I think you're kind of doing you're working this in between all the busy things that you're doing today, so I appreciate you being here.
Yeah.
Awesome. Well, first question I really like to kind of ask everyone is to just kind of, what's a little bit of your background and what was that aha moment that has kind of landed you where you are today?
A series of accidents. So I graduated nursing school in 99, went right into bedside, did that for a couple of years. And I think, probably at some point in nursing school, recognized that I wanted to go beyond bedside. I think what that means could be a whole bunch of things, and so I had to figure out which lane that sort of meant. Considered research, considered teaching, business,
so much, right?
Business administration. Yeah, I think it's actually a great opportunity. And so I quickly figured out that I wasn't a very good teacher. Research wasn't that interesting. And so business and the whole business aspect was. And so took opportunities to get into leadership situations, some management jobs, some things like that. And then, from there have slowly progressed throughout my career into, what is now leading a couple of different organizations over the past, I guess, decade or so. And so it's been somewhat deliberate, but also somewhat, I think a bit of luck, a bit of, making decisions in certain ways that maybe forced me a little bit this way. I did some education along the way. Like, there's been a whole series of things to get to where I've gotten, but at the same point, I think early on, it is really about that goal setting to say, yeah, I want to be in a position where I'm leading an organization. And so what can I be doing in my current role to, forward me towards that? Or what's the next role that I need to be thinking about to give me a skill set to then build upon? And so, I think that's translated over the last number of years into where I am today.
Yeah, no, for sure. I mean, I saw your post on LinkedIn and I was just like, I got to talk to this guy because it was really resonating with me how you, where you integrate a lot of just kind of those nursing concepts and caregiving into kind of the business world. Why do you think that's such a natural fit?
I think nursing has this amazing foundation that we probably all don't recognize when we're in nursing school. I think there's a lesson that we had to do. I don't remember what year in school, but at some point it was sort of this situational observation. So, in your daily commute or when you're on the bus or whatever it is, pay attention and start to understand, read people's body languages, and do sort of mini nursing assessments just in your head on different things.
Or
And
in
so
the
I think
security realm, situational awareness. There's so
right.
much overlap. Yep, go ahead.
Yeah, for sure. And so I think those skills ultimately that you learn during that time frame actually really translate well into things like sales. I think reading situations, communication, listening, assessment, planning, really trying to understand where that person's coming from. Those are all sales criteria, sales tools. I think things like empathy, compassion make a huge difference in terms of leading individuals, being able to be adaptive, dealing with multiple things being thrown at you, organization, time frame. I was fortunate enough. My first bedside job was in a busy inpatient oncology unit, and so that
Okay.
requires tons of technical skill, but you have to prioritize, get the big things out of the way early, and just all of these different skill sets. And I think if we sit back and think about that in the context of whether it's a leadership position or other types of roles, those are all foundational skills. And so I think nurses just in general are really set up for a lot of success that way. I think the other thing that's really great about nursing, and this is what I share with anybody's considering going into nursing school, is nurses can do lots of different things throughout a career with very limited retraining. I went
Yes. Yeah.
from that inpatient oncology unit to emerge quite literally overnight with basically no training. If I wanted to move into a different unit or a different type of nursing, you'll get the on-the-job training, but there's not a big, formal education requirement. And so you can make these kinds of changes, whether dramatic or even just incremental as you go through it. And so that's always stuck with me for nursing. And I think as nurses, we're really fortunate in that regard.
No, I absolutely. I mean, I've worked in like 3 or 4 different sectors now, and it's once you have those basics and those skills and kind of understanding just how people work and how the body works, the rest is just kind of the technical stuff
Yeah.
that comes with kind of each area. You touched a little bit on empathy and compassion. What does empathy and compassion look like to you, kind of in your leadership and in your CEO roles?
I think it it's so prevalent in many different avenues. So I think there's the easy things in terms of how we care for our employees, how we care for customers, care about the work that we're doing. But even if you take it a step further and look at things like if you're in a negotiation, so those happen in buying, selling, acquisitions, deals, those sorts of things. I think if you can use the skill of empathy and compassion to understand what the other person's perspective is, you can get to the crux of what the kind of issue of the deal is that needs to be solved from their perspective. So if you start to understand and appreciate where they are and what their need is, all of a sudden you can start to put together solutions and just different ways that you can approach it. And so I think of it in that way. There's obvious parts of, again, how we communicate to team members, how we work with our colleagues, how we work with partners, customers, but also there are these other places where, at least in my own experience, it served me to almost to an extent where I feel like I have an advantage, relative to maybe somebody else that would be in a similar position. So it's served exceptionally well.
Yeah, so that ability to just kind of build rapport and
Yeah.
really kind of get to the heart of the matter of things. I think because us as nurses, we see symptoms but sometimes the causes behind those symptoms aren't necessarily disease processes, right? It could be something psychosocial or something like that that's impacting these disease processes, and we really
Yeah.
have to dig deep on that.
Yeah, it's a
So,
great point. It's a great point. And I think, we have that training, that knowledge that we can rely on that really digs through and
yeah.
gets to those root causes more so than, maybe other individuals of different backgrounds than us.
Yeah, and just having people kind of open up. I mean, I don't know if about a world statistic, but I know like in the US it's like nursing is one of the most trusted professions,
Yeah.
in which people kind of put their trust in us and open up and do that.
Consistently.
Yeah,
Consistently.
consistently.
Like
Yes.
year
Yep.
over year over year.
Yeah.
Yeah.
Do you think empathy and compassion kind of plays a part in maybe like policy making as well?
Um, I think it can. Like, I think if you, I think it's inherent with lots of things. So I think we've always tried to, in the organizations that been involved with, especially at an ownership level or in a leadership role, have always tried to take the view that if we do the right things for our team members, if we do the right things for customers, if we do the right thing for partners and even our vendors that we're buying things with, the rest of the stuff will kind of take care of itself. And so I think the way that you do that is through all of those skills and building that into policy, whether formally or informal. I mean, I'd say fault or not, generally we haven't had a ton of policies because what we've tried to do is say, if you generally take the view of doing the right thing, that's the policy.
Yeah. So more culture building than policy.
Right, right.
Yeah.
And so if you're doing that, then of course we're going to make mistakes. But if the intent was always doing the right thing, then it's not a policy issue, or it's not an issue of malintent. It's probably an education issue or a learning point. And so if we can take that view, again, generally speaking, people are going to be more enriched by it.
Yeah, no, absolutely. How do you kind of deal with, I know there's nurses are experiencing violence kind of all over, whether it's the US, Canada, the UK. There's a lot of burnout because of that, and just other, social. We could talk about equity, equality, inclusion, that kind of stuff. How do you kind of address those issues in your role?
I mean, thankfully today, in at least in this organization, it's not a thing that we have to deal with or address. I mean, I think we have to be on the lookout for it and make sure that that if those kinds of things are arising, that we're dealing with it directly. We've had issues in the past with customers that are like really aggressive, who feel that the adage of the customer's never wrong gives them permission to be aggressive and quite frankly not very nice. Generally, we fire those customers,
Do
and we've
you?
been in a
Okay.
position where we have, and I think that ultimately goes back to doing that right thing for our employees, and so our employees have felt supported and ensure that it is. I think moving beyond that into front lines, which again, I'm on the different side, sort of the digital side of health, and so it's not that we have that front experience, but if I reflect or some of the partners that we deal with. Um, I mean, I think it's a problem, and I think it's a problem that's beyond our profession. I think it's a societal challenge to some
Yeah.
extent, because I'm not sure if this is post-pandemic and, people have just to some extent forgotten their way. I think that there's a ton of obviously illness and stress that maybe didn't exist before that places some pressure. And I think the other thing that we always have to bear in mind is, and to be clear, this isn't permission giving, this is understanding, is if we're in a hospital situation, let's say frontline, and somebody's being really aggressive and somebody's, behaving in that way, outside of mechanical things in terms of, illness or disease specific, a lot of times that is, born out of fear, and it's a reaction to the circumstance. Again, it's not permission, but I think if we can understand what that is, it can matter. I remember years and years and years ago, when I was in nursing school, as probably many other nurses do, I worked as a nursing aide. We call them personal support workers here in Canada, in a long-term care center. And so there was one particular gentleman who I was, assigned to care for that particular evening. And so he had this history. He had dementia, elderly gentleman. He had this history of violence, of being aggressive, sort of hitting, verbally, like all those sorts of things. And so I remember working with the team that I was involved with, and they sort of said, hey, you got to be careful. You got to watch yourself, make sure they're really aggressive, all those sorts of things. And I said, okay, fair. But while I was caring for this gentleman, I think what became pretty clear was his aggression came out when you try to rush something, because his dementia was such that was like a loss of control. And so he was basically just acting out as a result of it. And so every time that he would sort of start to amp up, if you slowed things down, talked in a calm voice, he would totally settle. I think the lesson in that is that oftentimes that takes more time than maybe we're allotted, either systemically designed or we allot ourselves just because we have lots of things to do. But I think sometimes you can change some of those behaviors based on, just responding in a different way. And so we as leaders have to build in that time to allow for that, and understand what that is. And so I think at that sort of policy level, it's not going to change everything. I think there's still, a lot of the challenges that we've described, but I think in those specific situations, it can make a huge difference. So I'm hopeful that as leaders in the front line, especially, that we think about things in those ways. I'm not sure that we do. I'm not naive to think that that's the answer, but I hope that but I think there's a lesson there that hopefully people can take away from this.
I think there's definitely like a lesson there in that, it is that culture building, and it's creating kind of that work-life balance, but even creating it within the system, right? And so understanding that patients and family members are going to need more time to kind of process this stuff. And I say a lot, nobody, we train to run codes, or maybe you're military and you train to, for combat, whatever. Nobody trains to have a disease, right? That's the last thing on our mind. And so when we find ourselves in a hospital, we don't have a prepared for that, right? Nobody thinks to myself, okay, when I turn 40, I'm going to have cancer and I'm going to know everything.
And the family dynamic that comes along with that, and feelings of guilt, feelings of loss of control, like all those sorts of things, for sure. I agree.
Yeah, absolutely. So what's kind of what's new in your world these days? What's kind of going on?
AI.
Yes,
it's new in everybody's world, right?
It is.
I think it's an interesting conversation. I think it's the world is moving very quickly. I think what maybe we don't appreciate is that there's a lot of technology that is already happening that's built into EMRs and just different things like that. And so to some extent, that there's been a lot of press and awareness generated over the last 1 or 2 years. The reality has been it's been going on quite a bit longer. Just the pace of change has gotten that much more quicker, even in
Faster.
even just, in the last 7 days
Year.
with, well, 7 days,
7 days.
like there's been a dramatic change just in terms of some of the things that have come out. And so, we are thinking about how can we, number one, utilize those to either make our work better, make our product better, generate more customers, those sorts of things. I think the second thing is how to use it safely. What's the right place? And I think from a nursing perspective, the concern is always like the AI nurse. I've heard different titles like that, and I don't think that's a reality. I think maybe not forever, but I think certainly for a long period of time, there's a physical and mechanical nature of what we do every day that is really tough to replace. And so thinking about it in a different way, which is how can we use that technology to make our lives, jobs, patients' lives, however perspective, different or better, is the one that we should be taking. And I think the really optimal skill for younger people right now is like learn how to play, learn how to use that technology, because the more comfortable you get as these things are introduced, you can start to look for patterns where it can make some sense of using it. And so on the one hand, there's obviously some scariness of, job replacement and, doomsday and some things like that. But I also think that there's some really interesting applications that are being used that make, not replace, but make in conjunction with the way that we think about things, allow for secondary checks and safety mechanisms and just different things that ultimately can improve patient care, health outcomes, those kinds of different things. There is the dangers of the risk of sort of over automating or over, I guess, analyzing, predicting. But again, I think the space for leadership to play is to say, we have to put in some guardrails in place to be able to manage that accordingly and get the best out of it as an amplifier rather than just as a replacement. So to me, that's really exciting.
Yeah, no, I agree. I'm excited for AI, and I never once thought that they were going to replace my job. I can see why people would, but I think now, and you mentioned over the next 7 days, I do think there's a little bit more of a shift now of, okay, well, is this going to make my job easier or harder? I think maybe we're starting to get over the it's going to replace me part, and really now kind of, is it going to make it easier or harder? And I actually went back and kind of looked it up and found an example from like the 1970s of AI being used to categorize infections and then determine the correct antibiotic to use. So like you said, it's kind of been slowly integrating into our EHR, but there's definitely been like this boom over
in
the
different
past couple
applications
years.
now, right? Like you have the voice to text analysis. So, making transcription a lot more automated than it used to be. I came up in the time of the old like dictaphone and whatever.
Oh.
Yeah.
I was gonna say DAR notes.
Exactly those things. And so there's a lot of automation that's built into it, which I think is actually a good thing because it allows for more time for the things that we were talking about before. In addition to better organization, using sort of improving the administration side of the work to a point where there's more automation in that to free up time to do more things. And I think, again, we have to be careful that we're not doing it to cut corners and, not allow for that other stuff to happen. But I think that there's huge opportunities.
Yeah, absolutely. Have you kind of had the experience? I know I see a kind of a lot of my maybe like CNOs and managers and such having to kind of wear maybe more hats than probably what they should have to wear. Do you see that kind of happening?
I think the entrepreneur lens is that you have to do that every day anyways.
Okay.
Sometimes you got to take out the garbage, like that's the way that it goes. And so I think, from my position, I think that that's just normal. Having said that, I think what I try to encourage, not just the nurses that work on our team, but I think everybody, is to say, these are some really cool things. Just play with it. Provided you're doing it safely, you're not using patient data, like those sorts of things.
Right.
But play with it and experiment, because you'll be surprised at what you pick out of it that can be used in different aspects of our business. And so I would encourage anybody. It's the same thing. I have 2 teenage daughters. I'm like, play. Like, the skill to do is to be able to play and learn and experiment and figure it out, because that will serve you well in the future. And so, that'd be my sort of advice to anybody.
I like that. And I know, we use Epic, and they do have the Epic PLY playground. So, if you want to go in and kind of check things out and do that, you can definitely do that. Kind of taking that subject, how do you kind of balance that work-life balance to where you're managing kind of that entrepreneurial side with life?
I think like it's a balance, which means it's not always balanced. Like, I think there are times, and again, this has been the case for a long time. I'd say it's no different from when working on the front lines. You have moments when you're working overtime, it's busy. I mean, this time of year, historically, in emergency departments is exceptionally busy because of influx of, influenza and just different things like that. And so you have these moments where you're just doing extra, and the objective is to then balance that out with times when you can catch your breath and, focus on all those other things. I think the thing to do is try to find, it's a hard thing to do, but try to find the joy in your daily. And so if you can turn what you do into something that you love, and that doesn't mean that, we all have to work, and, you may not want to work, but you have to work. And so try to make it great and be the best at it and learn from it and take that attitude. That balance is a lot easier to achieve, because you can find the times, because you're giving your all when you're there, you can step away and take a true break, spend time with family, be present, do all those sorts of things, because you've, been running all out while you've been at work. So I do all the normal things. I exercise daily. Lately have eaten much better.
No judgment.
My kids are really important to me. So I've always it's been one of the things that, again, has helped as an entrepreneur, is balance and family. Like, both my daughters were competitive dancers. I went to, I think, every single competition that they ever danced at. Every kind of event, school events that they would have, whether it was a concert or something like that, like, just make space, schedule it, and, let the other stuff. I appreciate that, shift work and things like that sometimes are more challenging with that. But even in the early days of shift work, tried our best to adjust and, work as a family unit and figure out the right way to get it all done. So I think it's possible. But again, I think you have to be aware that it's going to be more like this than just always even keeled.
Yeah.
But that's okay.
Yeah. So let me ask you, I'm curious, do you have kind of a time in your career where you were just burned out and made some pivots and some adjustments?
For sure. I remember not that long ago, probably 10 or 12 years ago. No, so I was doing kind of what I'm doing now, but it was, I was on a project, and that project was basically like going in and fixing a health organization, cleaning it up and doing it. Mm-hmm. And I remember there was a ton of travel involved, overnight travel and, all this sort of thing. And so I remember this one conversation with my wife, just sort of saying one night, I was like, what are we doing? This isn't sustainable. Like, this treadmill just won't stop. And she's like, yep, glad you see it, because like I've seen it for a bit. So okay, we're on the same page. So what's the plan? We just came up with a plan to say, okay, well, we're gonna like can't just stop now. We're gonna keep going towards on this path, but there is a point where we have to make decisions in terms of getting off that. So that's number one. And along that way, that allows you to start to create and network and build opportunities
New
for
opportunities.
to sort of shift. And then there's another moment. I was a healthcare consultant, and it was kind of the same thing. We were, as a consulting house, exceptionally busy, and so I was, as a consultant, was billing 8 days, I think, 8 days of work between like 3 customers, per week.
Oh, wow.
There isn't 8 days in a week.
So
how does that happen? That happens because, there was a lot of sort of 20-hour days and things like that. And so it was the same thing of, okay, this isn't sustainable. What can I start to do to fix that? Whether it's offloading customer or doing different things, again, networking to create other opportunities and things like that. So there's definitely been those moments. Thankfully I've been fortunate enough that, number one, supportive family. And so we've been able to have the conversations, and two, have the foresight to start to build that network and plans so that you have opportunity or like sort of the escape plan as necessary. So I think those are the things that you can do. Does that translate into frontline? Probably it does. I think, try to find places to educate yourself. As much as it's counterintuitive because it's getting busier on things, like volunteer for things, because those things will create opportunities, as well as sometimes offer a little bit of balance through the existing things that you're doing. Network and create a plan for how do you move beyond it. It's not going to be immediate, but that plan can really assist.
Yeah, no, I agree. I think kind of, I've been fortunate. I can't say that I've had too many instances where I've had burnout. And I think that's because as a nurse aide, I saw the other nurses being burned out and made a conscious decision that I wasn't going to let myself going to let myself get that way. But I think to your points, it's creating that support system, and then it's kind of constantly building towards that next goal or that next kind of step, and networking and creating opportunities for yourself. And that really helps, with that burnout, definitely. For sure. So you're in entrepreneurial. When did you kind of make that transition from bedside to entrepreneurial?
So bedside to management was, I think, about five years in. Looking out from that, I got involved with my first company, I guess going back maybe 15 years ago. I got recruited by my now business partner into a role, sort of a management role, to start building, and then from there started participating in ownership, and then since then we've had two other companies together. This is our third that we've been involved with. So typically we've taken a company, slowly built on it, grown it, and then the last 2 companies we sold in, roughly speaking, about 5-year timeframes. And so this is the third opportunity in terms of where it is. And so I kind of, like, as I said at the beginning of the conversation, a little bit of an accident. I sort of fell into it, a little bit of luck, some hard work for sure, but that's how it's all happened.
That's fabulous. So how many nurses do you have? Like, what's kind of the structure
today?
Yeah.
In this organization, so we're small.
Sure.
So we are about 20 people, and so roughly speaking, about a third of our staff is clinical. So what we do here is a big part of our I guess philosophy is, healthcare is complicated. I think, everyone would agree. Generally speaking, to your point, people don't have the experience of understanding or waking up and saying, I'm going to be in the healthcare system and figure out my way through it. So what we do is we help people have a better experience with the healthcare system. a big part of what we do is technical. So we have a digital platform that does a lot of that stuff. And then we marry that with call center services. So one-to-one conversations where our nurses do health coaching, concierge navigation services, and things like medical second opinion support that are delivering. And so today that's where we are. The largest company that I was involved with, so the first company that I was a part of from the ownership side was a staffing agency, and we probably had at any given time 400 or 500 nurses that were in the organization. So just varying degrees in terms of size. But those are very different. This organization to that is very different to some extent. That staffing organization, while it was in nursing, wasn't really. It was in nursing and in healthcare, but it wasn't really a nursing business.
It wasn't providing health, like care.
It's more like a fulfillment, an order fulfillment, where the nurses are the product, and it's a question of getting the nurses to the right places. The nurses are also they're both the supply, like inventory, as well as the product itself. And so, you had to sort of match and all those sorts of things. It just happened to be in healthcare. So a lot of the same things came along with it in terms of credentialing, education, risk management, all of those things. But I describe it less as a healthcare business, ironically, though it was the one where we had probably the most nurses.
Yeah. No, it's definitely more business. I think business, like you said, kind of supply and demand oriented, whereas it sounds like what you're doing now is more kind of connecting with those patients and providing those kind of services that are so needed. Honestly, like I love companies like yours because one, I think they're going to definitely get much bigger over the next, we got the baby boomers retiring, and we're going to have an influx of a patient population. And so having companies like that can really help facilitate those conversations between patients, families, and their caregivers is, I think, going to be paramount.
And for us here, so, from when I graduated, so this is more than 25 years ago, to now in Canada, and I think it's true, most of the world, when you boil down the healthcare systems that we all work within, certainly in ours, a lot of the same issues are here that were there then, like shortages of healthcare human resources shortage, like challenge in terms of resource constraints, access issues in terms of equal access, in terms of timely access. For us, wait lists in Canada, wait lists, continue to be a challenge at times and in places. Our geography doesn't really support consistency in terms of healthcare, right? If you live rural, remote, it's very different than if you live in a big center. Those are issues back then. They're issues now. Technology's gotten different, as we've been talking about, in terms of, I think, the practice itself. To some extent, the population's probably gotten sicker over that time frame in terms of acuity and things like that we tend to see. And the constraints have gotten even more so that people spend less time than they need to, getting, inpatient care and things like that. But when we put it all together, the reality is the similar complications are still prevalent. And so that means that normal people still need the support of these kinds of things. And so I think that there is, tremendous opportunity for our team to continue to do what we do over the coming years. Whether it massively expands, I don't know, but I don't know that it actually has to, because it continues to be, a challenge for individuals, because our healthcare system ultimately is complicated. And care is complicated. Like the level of personalization that's required to do it really well is really tough to systematize. And so because of that, individuals need that individual support. And so that's what we're here to do.
Yeah, no, that's fabulous. I absolutely, I think you could grow it to be a really huge company if you really
Sure.
wanted to. But again, those barriers come up. That individual needs of the patients, and can we really automate everybody's needs? And I don't think you can, because each one of us are unique, correct?
Totally.
Yeah. How do you recognize some of that uniqueness in your business model, and how you either deal with patients or even staff as well?
Exactly what I've been describing all the way along. Understanding what they're coming from, their perspective, take that into consideration. No two situations are alike. So, you can have in a clinical situation A through D, A through Z, maybe even, that are very similar in terms of age, disease, whatever it may be, and the person's needs are totally different because of their socioeconomic situation or their family situation or something else. And so you have to consider all of that in terms of how we plan support and ultimately deliver what we're doing. So that high level of personalization has always been important. I think it continues to be. And so I think the challenge is, it's in the entrepreneur world, that's tough to scale. Like, individualized is tough to scale, but I think you can do it really well if you allow for the time and have the right kind of conversation. And again, I think nurses are critical to that in terms of the skill set that they bring towards it.
Yeah, absolutely. No, I would agree. What other kind of barriers are you coming up against in kind of your practice right now?
I mean, for us, the big thing is I was having a conversation this morning, I think, about this very thing. I think when you're trying to introduce change, whether that's something that exists today that you're trying to improve upon, as a concept or as a product or whatever it is in healthcare and in specifics, but certainly across the board, it has to be dramatically better. Your solution has to be dramatically better than whatever today it looks like. And so the challenge is to make that gap large enough that it's compelling. So, like I always have said for a long, long time through many different organizations, our biggest competition, our biggest challenge is indifference on the behalf of whoever our potential customer, because it's easy for them to just do what they've been doing. So you have to create some urgency, you have to create that divide between what today looks like versus how you can support them with whatever product or service you have. And so for us, it's always trying to find ways to ensure that we're really maximizing that gap and delivering on the value between that so that it's compelling enough for people to do. Otherwise, we don't have enough people to support.
No, that's very, very poignant, and I appreciate you kind of breaking that down like that. I don't know if I've ever really thought of it that way, so I really appreciate that. Thank you.
Thank you.
I am curious, next steps as far as kind of bringing in new leaders into the organization, and because eventually somebody's got to replace us. What's your approach to kind of building that next generation of leaders?
I think it's a huge challenge. So the fortunate part of my world has been through the three organizations that I've most recently been involved with, because of a lot of the culture, because of a lot of the success that we've had, because of, I think, just the cohesion and what we've been able to do is we've had success in bringing a lot of the same people along. So my leadership team today is composed of people from my leadership team from the last company, from the company before. And so what that allows us to do is have consistency. We get to work together and really, you get into a flow. And so we can now start to bring along either other individuals that were already here or new people that are coming into it. But like anything, requires time, requires understanding. I think trying to filter out and ask really good questions along the way, being supportive, letting people leave that need to leave, doing all the things that you need to do, but it's work like anything. And it's a huge part. I'd say people is probably one of the biggest areas of focus, of my time, and I think certainly, our team's time over their normal day or normal week.
Yeah, just building those. I mean, it certainly sounds like you've built those relationships with those people. So, you talk about company loyalty, but you've had 3 different companies with the same people. So it sounds like it's more people loyalty than it is company loyalty.
Sure. Yeah, for sure. Like, and same thing on nurses. Nurses have followed and have been a part of the organization. So not just at the leadership level, at the frontline level. And that's because, again, believe in our values and I think thrived and all those sorts of things that we set out to accomplish. And so it's been beneficial.
No, that's fantastic.
Yeah.
Well, Jamie, I want to ask you if you had just kind of 3 tips, 3 practical strategies for incorporating nursing concepts into everyday leadership, what would they be?
I think listen. That's a huge one. Ask great questions. I think as nurses, we are trained to ask really, really good questions. So I think there's an opportunity within that. And I think we go back to that empathy, compassion. I think if you can build that in, it's counterintuitive in sort of the business world, but I think it actually matters ultimately in how customers perceive you, how you're perceived from a brand perspective, how your people, how you relate to your people, how you're able to build that culture, I think really matters. So those would be my 3. They're all kind of communication, which is interesting.
No, absolutely.
Yeah.
Well, I totally appreciate your time being here today.
Great conversation.
Yeah, it was wonderful. How can people get a hold of you or get in touch with you, connect with you? What's the best way?
Look me up on LinkedIn. That's probably the best place.
Okay, I'll make sure that.
Send me a message, and I'll. I'm happy to jump in and try to jump on a call if we need to problem solve or, try my best to answer questions, but certainly provide support, especially to the profession.
I have thoroughly enjoyed your posts, and
thank you.
They're so thoughtful, and I think your most recent one, you kind of talked about, the resume gets you in the door. What was it? The resume gets you in the door.
I don't even remember. That was a few days ago. Yeah.
Preparation. Preparation. Yes.
Preparation.
Yes. Yep.
Yeah.
So.
Yeah, for sure. It matters.
It totally does. Well, thank you again, and I hope you have a great rest of your day. And if you're watching, thank you. And if you're watching, I hope you guys subscribe and follow the podcast and also connect with Jamie.
Thank you.